Dermatovenerology. Topic: Venereology. Sexually transmitted diseases. Syphilis primary, syphilis secondary, syphilis tertiary, congenital syphilis. Venerology. The branch of medicine dealing with the study and treatment of venereal, or sexually transmitted, disease. Sexually transmitted diseases. STD are a group of communicable diseases that are transmitted predominantly by sexual contact and caused by a wide range of bacterial, viral, protozoal and fungal agents and ectoparasites. Bacterial infections. Viral infections. Symptoms. When men and women are experiencing these symptoms, itching on or around genitals, blisters and/or sores on or around genitals, wart-like formations on or around genitals, itching, pain or soreness in the anal area, discharge or bleeding from the anus. When women are experiencing these symptoms, changes in vaginal discharge or pain when peeing, lower abdominal pain, bleeding between menstrual cycles, NB. It is normal to have slight cervical or vaginal discharge that is colorless or slightly yellowish and that has a sourish scent, but if the discharge increases, changes color or becomes purulent, you may be dealing with an STI. Prevention of STD, STI control depends on education of healthcare practitioners and the public, avoidance of high-risk behaviors by patients, adequate access to facilities and trained personnel for diagnosis and treatment, public health programs for locating and treating recent sex partners of patients. Syphilis. Syphilis is a bacterial infection usually spread by sexual contact. The disease starts as a painless sore typically on your genitals, rectum or mouth. It also affects skin and mucous membrane caused by bacterium Treponema pallidum. It can also be transmitted by infected mother to its fetus. 4 stages of syphilis. Primary syphilis. After an incubation period of 3 to 4 weeks, a primary lesion develops at the site of inoculation. The initial red papule quickly forms a chancre, usually a painless ulcer with the clean base. When rubbed it produces clear fluid containing numerous spirochetes. Nearby lymph may be enlarged, firm and non-tender. Chancre can occur anywhere but are most common on the following: penis, anus and rectum in male. Vulva, cervix, rectum and perineum in women. Lips or mouth. Chancre usually heals in 3 to 12 weeks. Then, people appear to be completely healthy. Genital chancre. Anal chancre. Mouth chancre. Digital chancre. Investigation of choice. Dark ground microscopy shows corkscrew-shaped Treponema pallidum with spiral movements. Drug of choice. Benzathine E. penicillin. Secondary syphilis. About 1 to 6 months after the syphilis sore goes away, a rough, bumpy syphilis rash appears. The rash can cover your entire body, including your palms and soles of your feet. The rash doesn't usually itch. Symptoms. Spirochete spreads in bloodstream, produces widespread mucocutaneous lesions, lymph node, swelling etc. Symptoms typically being 6 to 12 weeks after the chancre appears. About 25% patients still have chancre. Fever, loss of appetite, nausea and fatigue are common. Headache, hearing loss, balance problem, visual disturbances and bone pain can occur. Rashes. Morphology. Asymmetric, polymorphous, pruritic. Types of morphology of rash seen except vesicles and bullae. Characteristic of secondary syphilis is examination of palms and soles. Syphilis. Secondary. Secondary simplex mimic many other dermatosis, causing a diffuse rash that may be macular, papular, or pustular, with discrete or confluent lesions. Syphilis secondary. A maculopapular rash on the palms or soles is characteristic of secondary syphilis. Syphilis secondary. Secondary syphilis mimics many other dermatoses, causing a diffuse rash that may be macular, papular or pustular, with discrete or confluent lesions. Clinical features. Condyloma lata. Characteristic lesions seen are condyloma acuminata pointed or anogenital warts. They are highly infectious, broad-based lesions. Present over moist areas like groin. Non-scarring. Alopecia. It is non-scarring type of alopecia. Investigation of choice. Venereal disease research laboratory test. VDRL. Rapid plasma reagent test RPR. Drug of choice. Benzathine penicillin. Given as deep intramuscular injection. Doses 2.4. Latent syphilis. 2 years is early latent, 2 years is late latent. If secondary syphilis isn't treated, it converts into latent syphilis. See fair absent. Serological tests are positive. IOC, enzyme immunoassay. DOC, benzathine penicillin. Tertiary syphilis. If patient in latent phase is not diagnosed and treated, tertiary syphilis develops. Tertiary syphilis, there are gummus, neurological problems, or heart symptoms. Clinical features. Rubbery nodules, which may ulcerate. Tabes dorsalis. CVS features. 1. Aneurysm in ascending aorta. 2. Valvular heart disease. Investigation of choice. CSF withdrawal. Look for CS pleocytosis that corresponds to Rx. DOC. Benzathine penicillin. 3 doses, i.e., 7.2 μ. Congenital syphilis. If patient suffering from syphilis gives birth to a child can develop congenital syphilis. Depending upon the duration, it is divided into 2 types. 2 years is early congenital syphilis, presents with vesiculobulous lesions and nasal snuffles. 2 years is late congenital syphilis. Presents with Hutchinson's triad. It includes 1. Eighth nerve deafness. 2. Interstitial keratitis. 3. Hutchinson's teeth. Central upper incisors with notch which are peg barrel shaped. Classification. Early. Late. Early congenital syphilis. Primary stage. Absent. Baby. Preterm, full term. Lack manifestations. Birth. Rhinitis. Pneumonia. Failure to thrive. Classical presentation. Birth. Wizened. Potbelly. Horse baby looking like old man. Withered brown skin and runny fissured nose. More prone for intercurrent infection. Scanned with CAM scanner. Bone lesions. During first 6 months osteochondritis of long bones, upper end of tibia, distal end of radius and ulna. Child presents with severe pain, tenderness while handling with consequent loss of movement, syphilitic pseudoparalysis. Wimberger's sign, loss of density on the medial side of upper end of tibia. Syphilitic dactylitis. Painless fusiform swellings of the digits. Osteochondritis of phalanges occur in the 2nd year of life. Stigmata. They are scar and deformity resulting from syphilis. Few are characteristic and remain as permanent evidence of infection. Egg. 1. Hot cross-bun look of the cranium. 2. Olympian brow, saddle nose, short maxilla. 3. High arched palate, bulldog jaw. 4. Saber tibia, scaphoid shape of scapula. Hutchinson's teeth. Seen at 6 years later. Permanent upper central incisors are shorter than the lateral incisors. Widely spaced. Have a notch in the biting edge. Mulberry Moon's molars. First lower molars. Commonly affected. Underdeveloped and poorly enameled. Patelloptes dome-shaped with small projections of ill. More prone to caries. Usually lost in early life. Interstitial keratitis. It's the most common late manifestation of syphilis. Age 5–15 years. Symptoms: unilateral photophobia, pain, excessive watering of eyes and blurred vision. Usually starts in one eye. The other eye is likely to be involved in a matter of 2 weeks.